Welcome to Boombastic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. I always use the metaphor squeezing through the knothole. Like there's always some knothole you're trying to squeeze through. And right when you get through that one, you find the next one, which leads me to a question about your psychology personally, what drives you. You've had fantastic success, got the opportunity now to probably decide whether you are looking to have a day job or just advising and quote unquote doing the fun stuff, letting somebody else squeeze through the knotholes. Talk to me a bit about what drives you at this point in your career.
Sure. So a few things. Number one is, we've still got so much to do in healthcare. And I feel fortunate at this point that I've made a lot of mistakes. So you learn so much more often from your mistakes than you learn from your successes. And I've seen a lot of things. And I think I, reached a point in my career where I can really help companies be impactful, as opposed to sort of treading water. We have a lot of companies in healthcare that tread water. There are a lot of companies that are, 2 million to 50 million. It's a $4 trillion healthcare space, and there's a lot of small companies. And so I feel like I really have reached a point where I understand how we can be impactful and how companies can be impactful. And I think we've still got so much to do. And so that motivates me enormously as you think about, just whether it's access to care, which has been a passion of mine throughout my career, or the proper use of technology. Right? Technology is an enabler of healthcare. Right? It's not a solution in of itself. A lot of people come into healthcare from other industries, and unfortunately, I think they lack sort of understanding of healthcare, which I think is often a detriment to their success. So I think number one is there's so much to do. The second is I think we're at the precipice of perhaps the most transformational technology since the internet. If you're not thinking about how Agentic AI is going to disrupt and change the way you're doing business, your head is in the sand. That's like thinking the internet wasn't going to impact your business. It is going to have a major impact on so many aspects of everybody's business, not just so you think about your actual solution or product in the market, but also how you operate. We've changed the way we do marketing. We've changed the way that we're doing sales. You should be looking at every aspect of your business. If I were running a company, I would be asking every head of every department to produce a memo telling how Agentic AI is going to impact their business and what they're going to do about it and how they're going to incorporate it. And if you're not, you're really going to be left behind. And so so that's exciting. And so the exciting part about it is that I think it's a transformational moment to really drive improvement in both access to care, cost of care, quality of care. And so that's motivating.
You've got this very special opportunity to do something that really powers up healthcare. And you talked a little bit about that, but people use this term now, Agentic AI. It's interesting. I'll give a talk and I'll say, raise your hand if you know what GPT stands for. And not a single person raises their hand. So we're in this world where we're using these technologies and talking about them, but people don't really understand them. So could you break it down to what is it specifically? How does the diagnostic robotic solution work and get plugged in a way that is efficient for the user, for the nurses or the whatever the clinicians are? And then how do you see that playing out over time? Like you said, the 10-year North Star that you had was 40x bigger or whatever, and you guys did it. Where are we now? And then what is that 10-year North Star that you guys have?
Yeah, for sure. So it's interesting, right? So, when people think about AI in healthcare, their brain automatically goes to, I don't want a AI primary care physician, or I don't want an AI, oncologist, right? I've got cancer, obviously that's a terrible situation to be in, right? And that to me is really valid, right? That I think the idea and concept that we will have AI clinicians is still a number of years away. And I think that's, there's a few reasons for that. Number one is people acceptance, right? Like, there's still going to take a while for people to get comfortable with the acceptance. I mean, I remember, my grandmother's no longer alive, but I remember with going to my grandmother first saw an automated checkout. She was horrified. Like, I chat to Betty on the way out every time I get my groceries. The idea that I would go to a machine and check out, she was horrified by that concept. But today we want the automated to become more and more efficient. The ones where you can just put everything on the counter and it can scan everything you have. We love those. And so it takes people time to accept certain things. And also there's enormous amount of research that is out there that shows that the human connection created between a clinician and a patient has an enormous impact on your ability to be well and stay well and get better. But what that doesn't mean, though, is that there's no room for AI in healthcare. And so where we've sort of myopically focused on is sort of what we would call the administrative tasks, the things that unfortunately take up like 80% of a clinician's time. And people don't realize this, right? 80% of their time is often spent doing administrative tasks and only 20% of them time doing clinical tasks. And so we're flipping that paradigm. We're enabling the clinician to spend 80% of the time doing clinical care and 20% administrative. So when you think about administrative care, one of the best examples I gave is, fortunately, I reached the age where I needed my first colonoscopy. And 4 different nurses called me for intake information. Just basic information, asking about my health, this, that, the other. All of that we at Diagnostic Robotics could have automated for them, right? And, fill out a questionnaire and ask people, have you had a colonoscopy before? All the questions that they asked me. And so we've automated all of those sort of administrative tasks. So the impact of that is really, really transformational. When you think about, first of all, we've got a staffing crisis in healthcare. We don't have enough nurses. There's a lot of burnout. And rarely do you hear someone say, I'm burnt out because I spent too much time with my patients today.
This description that you provide is the starting point of a bigger picture set of connections. And there's also this concept of health information exchanges. So I think a lot of times people hear about one type of interoperability or data exchange or connections, and it just gets confusing. And I think if you don't live it every day, which everybody in healthcare is exposed to this concept of communication between systems and integration, but most people, unless they're like an IT or they're a vendor that does these things all the time, it's just like over their head about what is all this different stuff. Like, is there any way you can help frame the different buckets of, you've got HIEs, you've got more like native HL7 integrations, you've got the EHR level connections. Epic and Cerner, they market their own kinds of ways to exchange data. And I know that alone could be an entire podcast episode, but I was just reflecting on your initial overview where you talked about HL7, you talked about what you're doing, maybe just framing what those different areas are and how this should be categorized. And then, like, do you think the killer app for how all of this gets solved, if there is one? Because every time something new comes out, it's supposed to be whatever that killer app is.
It's an excellent question and an important one, Bradley, because so far, for the most part, when people talk about integration or interoperability, it's perceived as an IT or a tech problem. And the reality is that interoperability or integration is a methodology or a tool to provide better clinical care faster at lower cost. And so I believe that it's incredibly important that we elevate the conversation from an IT conversation to one about a strategic conversation. How are organizations going to get the data they need to do the best clinical care for their patients on the individual personalized basis at the lowest possible cost? The healthcare industry, despite the 17 trillion or whatever that we spend on it every year, maybe that's not the right number, but it's massive, is broken. As you've written, the business of healthcare is broken and it's not getting any better. And so when I think about framing interoperability, I think about multiple levels. I think about the federal government's massive investments in and support of organizations like the ASTP, the Assistant Secretary for Technology Policy, the Office of the National Coordinator, to drive what's called TEFCA, which is the trusted exchange. And those sort of an HIE of HIEs, if I put it into layman's terms, incredibly useful and powerful for the large health systems to be able to transfer data amongst them. And it's all sort of behind the scenes. But where that breaks down is in a couple of different places. It breaks down in the places where you think about specialties, where they don't have the EHR vendor that they're using isn't serving a large enough population where it makes sense for them to make those investments in interoperability that maybe the larger ones, you mentioned Epic and Oracle Cerner. It breaks down there. It breaks down as well in the areas of the community that are not in necessarily the traditional acute care or even specialty care for health, but are adjacent to it, like behavioral health. Now, we talked about the opioid epidemic, but the behavioral health systems, for the most part, are not certified EHRs, meaning they haven't invested in and attested to the requirements about interoperability in a way that at least the larger in the acute care and the healthcare system is. And the third, and probably the largest and yet fully untapped, is in the social services market, with the industries like homeless management, information systems, and diabetes care centers, and so on, where they're in the community, they're interacting with individuals, and that data is not coded, it's not structured, and it's certainly not being presented in a way that's consumable by HIEs. So when I think about and frame to answer your question, number one is interoperability is about a strategic deployment of healthcare in a much better way for better outcomes at lower cost. Number two is the systems that are in place today are inadequate for reaching the totality of what's necessary to bring data into a applicable place where it can be actionable. And then number three is that I believe that it's important for those inside the health system and outside, like the diagnostic labs and imaging centers that we serve, for example, today, to have a toolbox to think about interoperabilities. There's no one size fits all. There is no killer app yet that brings it all together. In fact, the large tech companies, Apple, Google, Amazon, they've tried to create a universal health record, and they've quite frankly failed at doing that.
When you look at the state of the AI space, and specifically in healthcare, there's so much, I guess, change management that's required in healthcare. You've got a lot of people who have existing training for a lot of years, doing things the way they've always done. And all of a sudden now they're being told there are these new tools. There's some fear that there's some, group of people who are more excited and more those innovators that are like leaning into it. Yep. Some of that might relate to just sort of the vintage or age of the people and what their experiences are. But what are you seeing in terms of places where AI can be applied in healthcare that contemplates the fact that you don't want to make it so it's difficult to make that change because these folks are already overworked?
As I've consulted with different companies in healthcare, I've really come with a three-layer approach. Starting at the first foundation is how can we upskill your people to utilize off AI tools and just their everyday to become more efficient, right? I mean, there's even just that first step is one of value to all these organizations. But the second layer is looking at internal workflows that we can easily add AI to make more efficient, to automate, and to reduce a lot of the manual work that those people can put more creative energy at different tasks than a lot of the manual effort. So looking for those internal processes to automate would be the second layer. And then third, which I encourage companies to get to faster than waiting, is getting to more AI native applications. And I know we're going to talk about that a little bit later, but truly thinking about how do we solve their problems, take it down to the studs and really think of it in a new way from an AI first perspective and building product in that more AI native approach. And so each three of those layers is important. And I really encourage companies to do them in parallel as opposed to just waiting for that next layer of innovation.
So we say AI native, and it reminds me of when I first started HC1, we were one of the early players to be fully cloud native in the health tech space. And so this was about a dozen or so years ago. And with the pace of change in technology, at that time, cloud native was a massive leap if you had already built this entrenched, more on-premise kind of technology, or even the kind that was hosted somewhere but wasn't designed to take advantage of all these cloud tools, because the cloud infrastructure providers like AWS and Azure and, the whole litany of providers that are out there. Those are the two biggest. Obviously, Oracle's coming on strong now too, making Ellison for a minute the richest person in the world, which is pretty fascinating. But in any event, AI has come on as this big wave of power, just like cloud did relative to more of the incumbents that had been doing the antiquated type of approach where you had to install stuff on servers and so on. So when we started as cloud native, that was a huge leap. Now we're in this world of AI native, which the one way I think about describing that is if you look at the experience that you had with going to the library and trying to find information, and you'd go to the cart catalog and, there was this, if most people probably don't even remember that, but there was a thing in the cart catalog you would go to and you would look up what you were trying to find. Then you go to the shelves, and then search happened, and ultimately Google's version of search happened and made it so you no longer had to do all that. You would just do a search and you get this whole list. Now the behavior is you interact with ChatGPT in a way that's like having a conversation. So it completely changes the paradigm. It completely changes the user experience, the user interface. And to me, that's sort of the departure from the historical kind of approach to technology, which is analytics and workflows, moving into the modern AI world where it's more AI native. It's everything's designed from the ground up to say, what is the work that has to happen and how much of it can we make the agent do, meaning like agentic AI versus like the user. And when the user has to do things, it's more of an interactive approach. So do you agree that that's like the big difference between when somebody says AI versus AI native?
I mean, I think it's moving so fast. I think that's one stage. And the stage we're in today is taking a lot of that human language. What AI is really good at is taking a lot of that human language in and summarizing and spitting back all that information to really get to the main question you have and give you the right answer, right? I would say that where it's going or at the cusp of is actually not even making that user ask the question, but for have that ambient or agent in the background bringing forward those most important things for that kind of human in the loop to then tell it to go take action on. So I think it is stages. What you're talking about is AI native, but I do think there's a little bit of a current trend that when people say that they have AI, they're adding on kind of a chatbot experience onto their current product, which is a great tool, still really valuable. I want to instead of go through a 10-click workflow, I just want to ask it a question or tell it to do something, right? Which is great. But really where we're heading is fully a full new interface that isn't even just chat, that actually brings me forward what I need to know, and then just ask, do you want me to go do this for you? Right. And so making us not even have to always ask the right question. It actually is searching for the right questions for us to be asking and then can go take action. And ultimately, we're going to want us to take action in the background without us even having to say yes. Right. So it's a pendulum that continues to push forward. And I think chat is kind of the place that most people are interacting today from an interface standpoint.
So the idea being that, let's just use the concepts of generative AI and then agentic means focusing a specific type of AI agent that is generative on a certain type of task that is very defined. The process of identifying that care gap, communicating to the right people about it, there are a bunch of steps in there that people have to do now that you could theoretically have an agent do.
The care community is inundated with information. There's no lack of information. You know this as the chairman and founder of C1 and 3Aware and DecisionRx. The issue is, what do you do with it? How do you separate the signal from the noise? Well, there's two really deep sources of information that kind of complicate that's wearables technology and genomics, which radically get us in front of healthcare issues. But now AI and big data come along and allow us to synthesize that in ways that humans just can't possibly do. Now, the occasional genius healthcare provider might be able to intuitively put that information together and make leaps of care plans and treatments, but we really need to focus more on those outcomes and less on the cash register ticket punching of episodic care. And that's what AI does. AI allows us, when it's correctly deployed, to synthesize a lot more data that turns us from episodic care into longitudinal care. And those four drivers, wearables, genomics, big data, and AI, allow us to really become longitudinal care partners, the patients, the providers, and the payers, in a way that we just haven't seen so far. Create some challenges for the investment community to kind of figure out the winners from the losers.
Got it. So are there some examples that you've seen today where this type of AI is being deployed and actually driving that meaningful change? And then also I would ask, when you see that meaningful change happening, how do you think the economic models need to shift in order to fund all of this? Because if you have to wait to prove that everything's worked and how much it worked and how much it saved, that creates a pretty massive cash flow challenge for folks that are trying to do value-based care.
Yes, that's a great way to look at it and think about it. I think I would answer those questions in the reverse order. I think I just finished this analysis for another endeavor related to the book, but most of the investment right now in terms of raw dollars is going into those things that compartmentalize costs. They're going into payments and financing and reporting and compliance, because that's where the payers have the most invested, and it's the easiest kind of low-hanging fruit. But that doesn't directly relate to outcomes. What really relates to outcomes are, I mean, frankly, a lot of the businesses that you're invested in. It's going to be the diagnostics that give way to predictive insights and assembly of real-world evidence and genomic data. I think I just hit HC1, 3Aware, and DecisionRx would be three companies I refer to in the book. Those are the places where the investment community needs to flex. In terms of examples where that's already occurring, I can think of several. Wearables is a little bit different because it's consumer tech. Apple's going to see a comeuppance in the next 5 or so years because they're really very invested in a very complicated technology, the smartphone. Wearables technology delivers way too much data, and nobody has really figured out how to synthesize that and draw insights. I think companies like HC1 will be among the first to learn how to synthesize that data flow and develop meaningful insights. But if you move to the next level in terms of genomics, DecisionRx is taking pharmacogenomic data and changing what is the thorniest problem in healthcare today. 16% of healthcare costs directly are related to medication failure. And that's solvable by a $400 consult. So if you're a provider and you're not paying for that, you're violating your Hippocratic Oath. And I hate to be so dramatic about it, but that's one example. And what we've suffered from for so long is what traditional medicine relies on, is medicine of the averages. Two people, same diagnosis, could have completely different care treatment plans, but they typically don't get that in today's healthcare environment, value-based care, because it's medicine of the averages. I'm hoping that companies like Apple can really see their way out of this kind of proprietary ecosystem into more of an open source system like OpenAI, but I'm not counting on it. There's a lot of
hey, let me tell you something that just happened, and you may have seen this announcement that I just was absolutely euphoric about. The announcement that Alice L. Walton School of Medicine is opening. Have you read about this?
I've heard it. I'm not super familiar with it.
I'm going to read this from a Time article, and it's informed by her own experiences with healthcare. She's like, this is broken. And it was about the fact that it was totally siloed on the sort of traditional clinical versus more the wellness and preventative. So they say in this article, the school will train students over the next 4 years in a radically different way from the method most traditional medical schools use. And that's the point. Instead of drilling young physicians to chase symptom after symptom and perform test after test, Alice Walton wants her school's graduates to keep patients healthy by practicing something that most doctors today don't prioritize: preventive medicine and whole health principles, which involve caring for and not just treating the entire person and all of the factors from their mental health to their living conditions and lifestyle choices that contribute to well-being. Wow. I would predict that if you fast forward 10 years, the medical schools that are not embracing this kind of approach will be dinosaurs. With AI, you can identify these signals so much more proactively. So I think the timing of your book and this kind of work that you're doing, and frankly, we're doing in this community of more progressive innovators in healthcare, which is what this podcast is all about, I think the time is now.
Yeah, no, you're exactly right. We need something like the Walton School of Medicine to say, hey, delivering episodic medicine is helpful, but we're now on to stage 2 or version 2.0 or 3.0 of healthcare. And I agree with you. If I were to predict 2 or 3 years out, well, one example, Travis, you and I did an analysis, and I think the typical med school curriculum features 1 semester of pharmacogenomic training, and yet 53% of all medications are not metabolizable by the patient. And so that's clearly something that needs to change when you start looking at the whole person. So lots of things on the horizon. I actually, the final chapter in the book, I predict what primary care is going to look like in that same 5-year period. I think we're going to move from this gatekeeper mentality, which is going to focus on primary clinicians who are good at predicting, and primary care physicians who are good at acting at inception. And once you predict and head something off, you deal with half the problems. Once it's occurred and you deal with it at inception and hand it off to a chronicist, a geriatric physician, healthcare starts to look radically different. What does that mean, though? It means a lot more primary care docs need to be in the system, and they need to learn more to expand their top of license. Really exciting times. There's a lot of things happening that are going to change how we live longer and be healthier.
But if you zoom out, you see this total picture and it tells you something. It gives you such a more detailed set of information. And I'd say the same thing exists with your health. You have all these different factors, all these different signals. And like you said, wearables, more traditional healthcare. None of this is to say that you shouldn't go to the doctor and have a normal physical just because you're wearing a wearable. In fact, it says you should absolutely do that. And you should integrate all these other more advanced approaches to being healthier with your diet and exercise. But aside from that, no matter what your genetics are, if you're proactive about this really detailed level of caring for yourself, including your diet, exercise, supplementing, and you combine that with more conventional medicine, and you combine it with the kind of communities that make you healthy and happy, and, personally and professionally, you're engaged. But I think when managed the right way and using the kind of signals that AI can identify, you can really take things to the next level. This is a key aspect to the future of the way we're going to do business. And guess what? It is not possible without AI.
Yes.
And so I think that's an exciting example as well. You combine diagnosing people, preventing issues, helping people better manage their care holistically, with these signaling and quality measurement capabilities that no human could have ever done. The future is really bright, Jim. I'm excited about it.
Yeah, no, I would probably summarize with this thought. The current healthcare system, every healthcare system to date tends to look at an issue as a cost, but that's really the wrong way to look at it. Information is ultimately an asset. Once you know something and its predictive power, that is an asset. It's an asset to the patient because it can help them avoid a condition. It's an asset to a provider who's going to eventually have to treat that. And it's an asset to the payer who can avoid it and make savings. That's all crystallized in the Decision RX, Carlisle model of funding it, for funding Decision RX services for free, essentially, to the payer. But that's an enormous shift just to get over the fact that, hey, the fact that this person has an issue is a cost to be avoided. No, it's a savings to be harvested. Just by getting them to do the right thing and engaging them in their care is something that we need to turn the corner on. And the only way we can get there is, as you say, is with AI integrating all those sources of data and then flagging the signal from the noise and saying, hey, doctor, they can't metabolize lisinopril, so don't prescribe it to them. If you do, they're going to the hospital. If they don't, they're going to be better. The future's super bright. I'm super excited about it. And again, I can't wait to see what the next 5 years bring.
Hey, thank you, all of you, for being part of the Boombastic Health community. Thanks for joining us, where we've highlighted the great work driving forward the application of AI in healthcare to make it more personalized and better for all of us. Have a great day. We'll see you next Tuesday. Take care.